Your back affects your daily health. Welcome to another installment of Your Spine, Your Health.
Because you have a spine, it's important to understand what chiropractic care means to your health. Your health always starts with a regulatory college. In this case, the College of Chiropractors of BC serves to ensure you receive the appropriate diagnosis and care from a qualified chiropractic doctor today and tomorrow. That's also why BC's chiropractors fund research and education. Today, I want to introduce you to Dr. Carlo Amendolia, who's doing work on spinal stenosis.
The blood supply to the nerves, it's called ischemia, starts to take place where the blood supply to the nerve is diminished because of pressure on the nerves themselves. And this causes numbness, tingling, weakness, and all kinds of different sensations in the legs that inhibit the person from standing or walking for prolonged periods of time.
Spinal stenosis is the most common cause of pain, disability, and loss of independence among older adults. Many different interventions are being explored. This is Dr. Amendolia's approach.
So we've developed this program, it's called Boot Camp for Stenosis. It's all aimed at trying to maximize the cross-sectional area or increase the openings of the spine when patients stand and when they walk. And the reason for that is because spinal stenosis, although there's the structural component, which is the changing of the canal size because of arthritis, there's also a dynamic component to the condition. And what we mean by that is that the symptoms change depending on your body position.
The design of the program combines abdominal core conditioning through various exercises and common spinal adjustment procedures for the lower back to improve strength and flexibility.
So if the patients can get flexibility back into the spine through various techniques that we do in the clinic as well as home, then when they can get when they start to stand, that you might have that able to control that kind of alignment in the spine to maximize maybe just a couple of millimeters, but that might be just enough to allow less pressure on the nerves, more blood supply to the nerves, and minimize their pain and numbness and tingling in the legs, and allow them to walk further with less symptoms and hopefully improve the quality of life.
The program has been running for 2 years with excellent results and is on to the next phase.
But now we have to do a randomized controlled trial to see whether it actually is effective in comparing it to a control group, which would be usual care.
As you can see, it's not just about what we can do for you today. We're working to build a better tomorrow with better health outcomes for you. The College of Chiropractors of BC sets the standards for safety, outcomes, and your informed consent.